Delta State government, through the Delta State Contributory Health Commission, has carried out a one-day training exercise for heads of primary healthcare centers across the 8 local government areas in Delta Central Senatorial District. In an event held at Sunway Event Center, Ughelli, Delta State, on Wednesday, 16 July 2025, hundreds of health workers ranging from OICs, billing office and claim officers participated in the training as the government aimed to upgrade standard of health practitioners as enshrined in the more agenda of Governor Sheriff Oborowori, the Executive Governor of Delta State. Present to deliver the keynote address at the event was the Director General, Delta State Contributory Health Commission, Honorable Dr. Isaac Akpoveta, who over the years has registered millions of Delta into the Delta State Contributory Health Insurance Scheme, initiated 9 years ago, where residents get free medical care for a period of 1 year for a token of 7,000 naira. Dr. Akpoveta, in his speech, thanked participants for coming, stating that the exercise shall be carried out across the 3 senatorial districts in Delta State, as Delta Central is the second point of call, having held similar training in Delta North with the over 500 health centers in Delta State set to participate. Other resource persons took participants on training on modern technologies and applications to better their service in their various centers. Speaking to newsmen, Honorable Dr. Isaac Akpoveta unveiled more on the training, stating that the governor of Delta State is not resting as he gests towards improved health care for all Deltans.
The training is across the state. It is meant to upgrade their level of understanding of the current policy of the scheme. You are aware that we changed some of the key policies dynamics to ensure effective and efficient service provision in the state. Remember that the primary health care is the widest, most distributed facility in the state, covering almost every community. And therefore, if they can grab the basic knowledge and implement it thoroughly, a substantial achievement will have been made under this scheme. So today I talked to them about payment system dynamics, especially capitation and the bundle. What is capitation? Why is it important? Why we are paying up front and what they must do? And they understood that. To drive it in them. We also discussed about the bundle payment of antenatal. We also discussed who to register, how to register the person to ensure that non-residents of Delta State who sneak in to take advantage of Delta generosity is prevented and controlled. And they all agree with me. In fact, they confirm that some people will just come and register mid-term and they will not appear again until the last day of delivery. Those are interlopers that must be weeded out from the system. You can see that at the end of the day they were joyous, they were happy. We were able to tackle a lot of their doubts, and I'm sure performance will increase from now on. So the basic thing is that we are training the primary health care head of the primary health care system, the matrons and other persons, the head of what called OIC, officer in charge of the primary health care, and their co-workers, their bill officers, their dispensers, and so that they can understand the whole dynamics of health insurance. I started by even defining what is health insurance in a local language to them. At the end of the day, they were glad. We also informed them about what the governor is doing. The governor have done so much, released so much money on behalf of the under 5 and pregnant women, and why the government was particularly interested in the pregnant women. And they quite understood what is happening, and they are quite happy with the governor. You can see they were singing and praising the governor for his effort in the health sector. So it is here to upgrade their level, their standard of understanding of health insurance.
Speaking on behalf of participants, Nurse Alice Ikbe has told the governor and Dr. Akpoveta for the wonderful initiative and posited that the training will go a long way to improving their output.
I am Alice Jegede Ikben. I'm a deputy director of nursing.
Okay.
and my facility is Okwagbe in Ughelli South Local Government. New thing I saw today, for the director to start, Director General, to come down from his stool to come and train participants by himself. That's a very new thing for me. And apart from that, the way he consulted with everybody that were in the training today is a new dimension. And apart from that, there's another retraining now going on in the hall now. Although they've trained before, they now got that recognition that there are some people, maybe they might have changed people from one health facility to another, and they are retraining those people. So it's a very welcome one, and I like it so much, the training of today. So I was able to solve my challenges here. And the way he said it, that it's going to be continuous quarterly and continuous training, I think it is beneficiary. And the more you train people, people will be masters of whatever you are training them on. So it's a very good one, and it's going to benefit the primary healthcare setting.
My name is Rero Henry Akbos, and this is Rero TV. Thank you for watching.